Okay, good morning, everybody. Thank you for joining us on a Friday. And hopefully, as Jules said, we will get through the remaining business. And then for future conversations regarding strategies for next year, applications to all those things, we're going to try and schedule something probably in January or February to start those discussions so that you're ready for the next process in the spring. So today's goal is really just to get through these scenarios and decide on what our recommendations are going to be. So sort of picking up where we left off, Jules, do you want to kick off with the unfinished business?
Yep. So just as a reminder where we left off, and please anyone jump in if you have questions, concerns, points of clarification. I believe all our committee members were here last meeting as well and engaged in conversation. But as a summary, where we left off, I'm actually going to go to the summary page. We've been working from scenario 5. To summarize, we have decided and taken votes on funding cancer programs, tobacco prevention and control programs, and behavioral health programs at 100% of their fiscal year 2025 budget. We also took votes on funding the disability program and our workforce development programs at 80% of their fiscal year 2025 budget. This excludes AIDS Delaware, which it was voted on to fund them at 100% their fiscal year 25 budget because they did not put an application in for fiscal year 20. That fund them at 100% their fiscal year 24 budget because they did not put in an application for 25. And then we also took a vote on, and this was back at meeting 2, not funding the Behavior Risk Factor Surveillance System Survey, which is a DPH program and a new program. We will be revisiting that category today, so we can also have further conversations there. That summarizes what we have made decisions on. To give a quick overview of what we haven't made decisions on, we have the family and caregiver programs left to discuss, our DHSS/state operating programs to discuss, our other program to discuss, and our new programs to finish discussions on. So again, we have quite the list to get through. However, we've gotten through most of our categories so far.
And Jules, do we have a total for what we voted on so far and what's left?
So far, we have scenario 5 includes what we have made decisions on, and that's 18.2. And then left would be 17.5. So about halfway through our funding amount. I think Rep. Bombeck, you had an actual percentage. I don't know if you remember that off the top of your head. I thought it was
78% of the expected money coming in, including the interest.
Perfect. And so, yes, to point that out, that number, that 78% want to include this reserve balance, which we think about differently because we've been very intentional to keep that reserve as a separate funding amount and tapping into that differently than the expected. Any other comments on that or clarification, points of clarification? We do. Sorry, go ahead, Secretary.
So the total remaining, the 17, that does include the reserve.
The
Yes.
amount.
Yeah.
Right.
Yes, it does.
Okay.
Yeah. I think Christine is on here too. So.
Okay.
So looking at it a little bit differently, if we want to preserve the current reserve balance, we have about 5.2 million to spend.
Yeah, that was going to be my question. Do we want to try and draw a line on the reserve before we start talking about the remaining programs?
Can I mention, Jules, in the file that you have under DPH, it notes that in, I think, fiscal 2020, there was 6.7 million taken back into the operating budget by the General Assembly. So, if us asking the generals, us recommending that the General Assembly take back a good portion of those programs is precedented. And especially, I think it's well supported given the precarious situation. So I like the Secretary's question about should we come up with a guiding principle for what we recommend be done with safeguarding a portion, maybe all, of the reserve balance.
Thank you, Representative. Are there any thoughts on that?
My thoughts are at the rate we are getting the reimbursement, I believe the $12 million we have in the reserve, if anything, that should be our goalpost because technically we should be adding to it as time goes, as the depletion is going to happen on the other end, just to counterbalance the two.
I think we had, Pri, do you have available the reserves history the last couple of years by any chance? Andy to share.
I do not have access to the drive at the moment.
Let me,
But let me
I
check.
may have it. I'm looking.
yeah, I think I did share it via email.
You did share it, yes.
Jules, this is Christine. I have it if you'd like me to share my screen.
Oh,
Yes, please, that would be awesome. Thank you. All right, so looking at these reserves, going back to fiscal year 18, 4.2, and it looks like there are efforts by the committee to up it, and then fiscal year 2026, it looks like it went down about 3 million. So I know this has been a main source of funding, but a big point of focus for the committee to ensure this balance stays at a healthy amount. So I apologize if we're repeating or we're shifting through some papers over here. Is there a number this team wants to ensure it stays out?
I would like to see it stay at least at 2/3 of that, a little bit over 8 million.
8 million. Are there any other thoughts about that? And again, like you said, Representative, these are suggestions and recommendations, and we'll include narrative in our report to explain further our intent behind the reserves and why it means something and the intent to keep it at a healthy amount. This will be working as well. Are there any other committee members have any thoughts about the 8 million in the reserves? That would be down about 4 million.
I would be happy with that as long as we can vehemently articulate our concern about this continuing dropping, and that over time the General Assembly accepts all the programs back so that we can more closely fund the programs that we have been up to this point. So I know that we don't have any legislative authority, but if we can, really articulate how our feelings about this, I think that needs to go with the report. And Secretary, that really, I think, comes back to you in terms of your testimony and also your written report to the governor.
Yes, I'm happy to do that. I do have, if we're all in general agreement there, we can start having more specific conversations. I have a question, and I'm going to apologize for my ignorance, but even though I came here last year, it was all packaged up pretty nicely. And I really didn't probably know enough to ask as many questions as I am this time around. But the Innovation Fund, I guess my question is, I don't know when that was, the history of that, how that came to be. It's not something that there's an application for. It's something that I guess this group decided to create. And I just, if somebody could share a little bit of background about that, because I also want to, that may be something that we discuss in our future meetings about structure and how we're doing things and what kind of data and measurables we want back from them. So I don't know if there's historic knowledge about how that was created, how they're getting this funding, what the parameters are for it, or anything like that.
Don, you want to go first?
Yeah, I mean, this was kind of my baby. It started probably 10 years ago when we were experiencing a reduction in the resource from the Master Settlement Agreement. And we also had the General Assembly that were removing funds from our reserve account. So my concern was twofold. One, that those resources were dwindling and eventually it could run out completely. And secondly, we weren't able, because of that situation, able to entertain new programs. And so I had suggested that we set up this innovative fund, putting aside money specifically for two reasons. One, to entertain new and innovative programs that we would not be able to fund otherwise. And then secondly, use it as a conduit for leveraging additional funding outside of the Master Settlement Agreement, so that even though the resources from the MSA were decreasing, we could look for revenues beyond that. So I brought it up and we discussed it probably for 4 or 5 years. And it was in each of those years, it was voted down. Finally, 4 years ago, it was approved. As I've articulated earlier in these meetings, it's been a overwhelming success. Currently, we're funding 78 additional programs throughout the state of Delaware, and we have leveraged about $20 million of additional revenue as a result of that funding. So I don't know if that helps or not.
No, that was my sort of like general understanding of it, and I guess I just wanted to. What I was struggling with a little bit is, you know, they've got their own application process, they've got their own review process for programs and vetting programs and measuring outcomes and all of that. So why? And I'm not intending this to be controversial. This is a real question mark for me. Why don't we just give them all the funds and let them do the process?
Well, that's a great question. Although they are specifically, their charter specifically, and I think Kate is on this call, so perhaps she can provide some additional information. But their charter is really going after the social determinants of health, and of course, obviously, tobacco and cancer is one of those features, but it's not the exclusive feature of the program. So I don't know if we want Kate to articulate further on that or not.
If she'd like to. And then my other question about it was, is it possible that a provider is applying to both the community, My Healthy or Healthy Communities Delaware, and to us for funding?
I don't think there's any exclusion to that, but it hasn't happened so far.
Okay.
Okay.
Along those lines, oh, I know.
Sorry, go ahead, Dr.
Secretary, I think I
Reyes.
would agree everything that Mr. Fulton said. And about 4 years ago, as he said, we were at a crossroad, and also Delaware was doing some innovations. And we felt that maybe we need to put some seed money into some of these programs. For the first year, we got involved in terms of helping to determine where the funding goes. And then automatically, as Mr. Fulton said, that we also looked at the social determinants of health. And between the two, it started out to be $1 million each year. And then for some reason, it has gone back and forth. But that was a history that was started back in the days. About 4 years ago, we had the courage to set aside both in and out. And I think we see a lot of return on investments. In terms of the applicants for the first year, they were from everywhere. And I believe, as Fulton said, I didn't know whether there was any restrictions if going from one to another, but thinking out loud, if there were to be a need that was coming, one for technology and the other one for the routine things, probably that could have happened or could happen in the future. So that was just my 2 cents in the process.
Thank you.
Good morning. I had a similar train of thought once I learned more about the Innovation Fund in regards to their rigorous process of evaluating applicants, and also not only evaluating applicants, but working with communities to identify the need and soliciting applications and working with partners to apply. In many ways, their process is a lot more thoughtful than our current process of funding new programs. One of the things that I've been concerned about is the lack of knowledge and awareness about the health funds. But one of the things that the Innovation Fund does is actually goes to the community and works with community partners and help them to even apply for funding. So I'm in agreement in many ways to, if there was an opportunity to provide even more supports, possibly their process being how we fund new programs, because they have a more rigorous process in evaluating new programs. So a few ideas to think about.
Is there any additional detail I can provide? Secretary, one additional thought I wanted to clarify is at the creation of the Innovation Fund, which was done when Dr. Carol Rattay was the Division of Public Health Director, we were coming to the conclusion of the federal SIM funding to the state of Delaware that was focused like millions of dollars focused on healthcare transformation. A very small amount of that federal funding was focused on community investment to improve social determinants of health, with the understanding that 80% of our health is derived from the places where we live, learn, work, and play. So we tend as a society to focus much more of our investment on healthcare, whereas we really need to be shifting some of that investment upstream to where communities are. So after Dr. Rattay did a kind of a roadshow at the completion of that federal funding, there was consensus across the state from stakeholders that the state should continue the sustainability of investment in communities. And that is in partnership with Mr. Fulton, Mr. Patel, et cetera. Dr. Rattay was advocating for the Innovation Fund. So the Innovation Fund is now what Healthy Communities Delaware facilitates investment into communities in terms of long-term partnerships with the goals of improving health, well-being, and equity across the state. And I would be happy to, oddly, I'm not sure why this is, it is a weird setup to have us apply for our operational funding, but not for the innovation funding. So that does make it confusing. That's just the way it's happened for the last 5 years. But we're happy to discuss playing additional roles to support the Health Fund Committee if desired.
Thank you. I appreciate that. Yeah, I mean, I think I'm really looking at things from an operational standpoint and trying to understand, that a large chunk of the fund is going somewhere else without an application process, right? And that is so I'm looking at it from a process perspective. It's not a commentary on what the fund is doing, because I've actually looked at the brochure and the website, and I think there is a lot of data and measures there that are great. I'd like to see that for this fund as well. And so that's really where my head is. And I really, I don't want to derail the conversation today, but I did want to raise that.
Thank you, Secretary. Christine, are
Secretary,
you?
while we are looking at this, and I think maybe it's just, maybe, I don't know, it's my expertise, but I wanted to share with you that as we know, tobacco funds in my mind is, I just don't know how different it is from the opiate funds. And those monies did came the first tranche, and I believe it's going to continue. So there may be some management economy of scale, but again, that is beyond my pay grade.
Yes, thank you.
Right. Thank you. Christine, are you able to share screen for the scenario to run through that? And Secretary, that wasn't off. That was part of our conversation today, the Innovation Fund. So exactly in line with where we're moving.
Hey, Jules,
Yes.
on the family caregiver programs for the Ecumenical Council, is that 153.2 a mistype? It was 133 and 24. They're requesting 133 and 26. They reference 133 in their application. Is it possible that 153 is an error?
This was in, sorry, I'm scrolling on my end. No,
Okay.
I think, I don't, let me pull their application, but no, I think they must have just requested less money. You can go, Julie. Julie Devlin, our Chief of Staff.
Hi, everyone. It's Julie Devlin, Chief of Staff. They typically request 133 and through the joint finance process have gotten the 153 in past years. And so they might have reverted back to the 133 based on their past asks. But Jules is looking to clarify.
Well, it's presented as us having recommended the 153 last year.
Yeah.
More, but I don't know what was requested.
I'm thinking they must have requested the 153 in the budget last year. I'm looking up the application.
They did.
Not a biggie. I'm just a head scratcher. Thank you.
Yeah, and we're looking. They typically utilize all of their funding. So
Well, it's possible they found another funding source as well. I mean,
Mhm.
who knows? But if that's their request, that's their request.
Yeah. I don't know. Christine, are you able to share the scenario?
Corey was going to do it. Corey, do you have access?
Yes.
We just confirmed they did request 133 this year. So not sure why, but that is what they put in their application.
I had seen that. I just noticed that the table reports that we recommended 153 last year.
Yeah, that's correct.
Okay.
Ask for one.
Yeah.
Yeah.
They did last year.
So it looks like last year they requested 133. Well, this is fiscal year 24. They requested 133. Scenario 5, we suggested 133. So they must have requested 153 last year, because it looks like they've been toggling back and forth between 133 and 153, alternating the last couple of years. So
Okay.
yeah, it just seems like I'm not sure. We'd have to look specifically at the actual budget request in there.
Maybe they were listening to my whining last year and they felt like they should be asking for the lower. Yeah.
This is the year to ask for less. So any thoughts, if everyone's okay with staying as family caregivers, or we can jump down to the innovation fund, whatever this team is thinking, but defer to all of you. And we can also play around with numbers if you want to see what certain things are funded at, so that we can see how much is remaining. We can do that too before we take formal votes. We have our budget team here to work through numbers and be able to digitally see it.
Especially since they went down, I'm going to throw out recommending 100% of their fiscal 26 request. And I'm both of these two. Easter Seals is a very small request.
I'll second that. Don, both of
Right, so I have a motion by Representative Baumbach to fund the Family and Caregivers Program at 100% their fiscal year 26 request, seconded by Mr. Fulton. Do we have any comments from committee members before I call roll? All right, I'm gonna call roll. Representative Bolden, absent, I believe still. Senator Richardson?
Yes.
Thank you. Mr. Fulton?
yes.
Ms. Massa?
Yes.
Rep. Baumbach?
Yes.
Chair Manning?
No.
Mr. Patel?
Yes.
Dr. Silver?
Yes.
Ms. Tuxford? Absent. Dr. Lee?
Yes.
Senator Poor? Absent. All right, the roll call for that is 3 absent, 1 no, and 7 yes, so that motion carries.
Jules, is it correct that all the remaining ones have some relation with DHSS, DPH? Oh, I see DAPI does not. And
Yeah, we
Healthy
have,
Foods.
some of the new programs are outside programs.
So I'm going to suggest we do the non-directly state-related ones, maybe the new programs next.
Okay. We can absolutely do this. I believe in the beginning, well, not the beginning, in meeting 2, the committee had discussed not entertaining new programs until going through other programs. So as long as the committee agrees to move forward with looking at new programs first, we can most definitely do that. I just want to note that there was discussions to wait to the end to look at new programs. So any thoughts from committee members? We can pull up the new programs there. Thank you, Bree. And where we left off with some of these new programs, just to spark conversation, is I believe all of these, well, first we did take an official vote on the behavior risk factor surveillance system survey to not fund them. In terms of the Sean Locke 24 Foundation, Healthy Food for Healthy Kids, DAPI, and the community mobile health units, off the top of my head, I remember the secretary summarizing well that these programs had other sources of funding. So G was leaning towards not funding them. And she can speak to where her head's still at, but that's kind of where we summarized and ended up. And then we heard from Health Literacy Council last meeting, and More Than Fitness, we reviewed more data from them after the second meeting. So open the floor to all of you.
So I'll start. Again, this is not a commentary on the quality of the programs. I'm a huge fan of several of the programs on this list. However, the majority of the programs receive grant and aid funding and other funding sources and other streams. And when asked what they would do or what they could do without our funding, they all seem to have fairly good plan Bs. And so I'm not seeing dire need here, and nor am I seeing for several of these a direct connection to our core programming. The only two of these that I would arguably pull out would be the Health Literacy Council and the Community Mobile Health. However, that's a DPH program, so I think that's a different conversation. And I would understand that not being funded here. But I would be content with a motion that none of them were funded, or that none of them, except for potentially health literacy, were not funded. That's where my head is.
Thank you, Secretary.
If it needs to be funded, Healthy Literacy is asking for 400, and we have been previously provided them with 200. If it's a program that you want to save, then we could probably fund them at the previous years, like 200, and fund nothing else.
Yeah, I'll be honest. I was only looking at the FY25. I wasn't thinking anybody was getting an increase necessarily. So thank you for pointing that out.
Yes.
So I'll recommend that health literacy be maintained at the fiscal 25 budget amount, and the other items in this category not be funded in our recommendation.
I second it.
Wait, let me just jot this down real quick. So I have a motion by Rep. Bomback, seconded by Mr. Patel, to not fund new programs except for the Health Literacy Council. That program will be funded at the fiscal year 25 budget amount. Perfect. Any comments, questions, concerns from committee member before I call roll?
I just have one.
Yeah, go ahead.
Marshall, one more question about DAPI. Just wanted to make sure that they did state that they had additional availability of funding.
Dr. Lee, from my recollection of the meeting, as well as the chair here and our chief of staff, is that they did indicate there was other funding for their program that they would tap into.
And they also received significant grant and aid funding.
Excellent. Thank you.
Yeah, they receive $866,000 of grant and aid funding, which is 75% of their budget per their application.
Thank you.
Thank you. Representative Bomback, did you have a comment before we go to voting?
No.
Okay. Awesome. So again, the vote is on not funding new programs except for the Health Literacy Council. That'll be funded at the fiscal year 25 budget amount. Representative Bolden. Absent. Senator Richardson.
No.
Mr. Fulton.
Yes.
Ms. Massa.
Yes.
Representative Bomback.
Yes.
Chair Manning.
Yes.
Mr. Patel.
Yes.
Dr. Silver.
Yes.
Ms. Tuxford. Absent. Dr. Lee.
Yes.
And Senator Poor. Absent. Chair, the roll call on that is 3 absent, 1 no, and 7 yes. Therefore, that motion carries.
Thank you, Jules.
Yes, and thank you, Flurry, for updating that. Next, is there a preference of the committee to jump to another section? We have switch fund programs, other program, which we started a conversation on, which is the innovation fund. And then I think we state operated. Yep.
If you'd like, and we do have an update we can give on the state operating programs. At the last meeting, some questions were asked about how those programs had utilized their funding, if they used it first, if they used it all. We did dig down on some of that, and so Julie, my chief of staff, can provide some background on some of those things.
Thanks, Secretary Manning. Hi, everyone. Julie Devlin again. Yes, so we looked at not just the state-operated DHSS programs, but we also looked at the 3 switch-funded programs as well, since they are operated by the Division of Public Health. And we are looking at the FY24 budget because that is the last full year of funding that we had. And so for all of the programs, only 2 programs did not spend out all of their funding. And that was the Social Security Income Medical I am reading the wrong thing. That is the Social Security Income Supplement Program operated by the Division of Social Services, and they reverted back just over $119,000. And then the other program is the Delaware Prescription Assistance Program, or DPAP, operated by the Division of Medicaid and Medical Assistance. And they did not spend around $350,000. Other than that, all of the programs, and Jules are you sharing it? All of the other programs spent everything. And so if they are funded with other sources of funding, they typically spend the tobacco funding first to ensure that it is spent out. And I'd be happy to answer any questions.
Can we, I'm sorry, and this is purely my preference. I'm fine getting overruled on this. I'd like to get I think one of two ways. We deal with the state programs and then we do the innovation fund, or we deal with the innovation fund and then do the state. As of right now, if we funded both of those categories that 65% is the midpoint between using the remaining dollars and using the remaining dollars and 4.3 million of the reserves. So if we were to do a single motion for everything, I think the percent amount should be somewhere between 77 and 52%, and 65 is a nice midpoint in there. But I guess I'm interested in the committee's view on the innovation fund and what that should be. And I feel like most comfortable then backing into what our recommendation should be for the state, whatever, cross-listed programs.
I would agree with Representative Bomback.
Works for me. So we're looking for agreement or discussion and agreement on the innovation fund first, correct?
Yes.
Yes.
Okay. And do we want to discuss funding it at the same level, or do we want to discuss the increase they've requested? What's the pleasure of the committee?
I believe the program started 4 years ago, had the intent, and I believe the intent has done its job. I don't think it was here prior to 4 or 5 years ago, and their request is higher than what they have been funded. Because having the shortages of the fund, and I don't know whether they are only relying on this fund to do everything, because it's a co-partnership, I am open to just fund the $1 million and dwindle it down as time goes, because our seed money should start seeing something.
I'm going to uncharacteristically avoid my Paul the Knife approach. And given that our recommendation will be for cutting state funding, and it seems like this fund, I noticed that when its inception matched when the state stepped up and switched back $4 million of requested stuff that was related to state things. And it may be that if the state government follows our recommendations and switches back millions of dollars of these state-related ones, there will be a greater need for the things that the Innovation Fund supplements. But I defer to you guys with more history than me as to whether these are non-overlapping items. Does that make sense?
Yes.
It does. I believe it's non-overlapping, in my opinion. I don't think that in the considerations of whether or not they're switch funding our programs, they're giving a lot of thought to how we're using this particular fund. I think it's a matter of looking for ways to fund the operating budget, period. And if they find a way that, and they can put it in the general funds to free up these funds, whether we give more grants through this process or we give more to the innovation fund, I don't want to speak for them, but I don't know that OMB or anyone else has a strong opinion about that. If they do, it has not been expressed to me.
I would agree with that as well.
Well, if we did 80% of fiscal 25, that would be 1.2 million. And which is obviously 60% of their fiscal 26 request. So for discussion purposes, I'll throw out 1.2 million for 80% of their fiscal 25 budget.
I'll second that.
Okay.
All right. On that.
So we have a motion and a second to reduce to 1.2 million for the innovation fund. Is there any discussion around that? Any questions, comments?
I just have a question. Are we getting away from the original purpose of these funds? Are we just trying to fund some things that, we found this source of funding, but the source of funding was supposed to fund smoking cessation and some other and some other purposes, but I think we're getting away from that. So every dollar we spend on something else takes away from that original purpose. Am I right or wrong on this?
Senator Richardson, may I share? I had the same concern with you that you're sharing now. And as I looked at the code, I believe that there was mission creep, and that the stated statutory goal mission of this fund has expanded from its original design. So yes, we've gone beyond our original goal, but I believe that's statutorily supported. And perhaps somebody else can let me know or can share their view as to whether what I just said is correct or not.
That is correct.
It might be supported, but is it the best use of the funds?
So the criteria is fairly broad. The goals are expanding access to healthcare and health insurance, maintaining long-term investments to enhance healthcare infrastructure. And I'm abbreviating some of these. There's more language around them. I'm just giving you the general flavor. Promoting healthy lifestyles, including the prevention and cessation of the use of alcohol, tobacco, and other drugs. Promoting preventative care for Delawareans in order to detect and avoid adverse health conditions, particularly cancer and tobacco-related diseases. Working with the medical community to provide funding for innovative and/or cost-effective testing regimens to detect and identify lesser-known but devastating and costly illnesses, such as sarcoidosis. Oh, there's a bunch of these I can't say. Fibromyalgia, lupus, Lyme disease. So not all related at all to tobacco. Promoting a payment assistance program to Delaware citizens who suffer from debilitating chronic illnesses such as diabetes, kidney disease, which are characterized by recurring costs for equipment, tests, and therapy, and such other expenditures as deemed necessary in the best interests of the citizens of Delaware, provided they shall be made for health-related purposes. So it is really broad. I know because the funds came from the settlement, we all feel strongly that there should be a core connection there. But I also think that, there are derivatives of health conditions and other things connected to health and well-being. And some of the things can lead people to smoke and drink, and other things are the results of smoking and drinking, and other things like that. So I think it's interconnected. I hear your point. I understand your point. I think the committee has struggled with this because they want to be true to the source of the funds, but statutorily, it is actually extremely broad.
And just to echo the secretary and conversations we've had as a committee thus far, these are things we want to talk about in the not off season, but meet outside of this window of application review to discuss these things. What's in code?
Yes.
What are we upholding? What's being submitted to us? So this is part of that larger conversation that we definitely will want to continue into the winter months and the beginning of the new year before applications come out again. So Senator Richardson, appreciate you pointing that out so we can have these conversations.
Yeah, I mean, to be clear, I'm going to be asking this group to reconvene for the purpose of looking at the timeline, when our recommendations are due, looking at the statutory enabling language, all the things that Jules
All of
said,
the above.
our application process, our data measures, and our evaluation process, all of the things that this committee has expressed interest in, we've got to do the work to address them. So I hear you, and I think that's a conversation that may require, if this group desires it, statutory change.
So I guess my other question is, if we don't approve the $1.2 million, will this have a dramatic effect on this organization?
Yes.
Okay, I might bite the bullet this time.
Is there any other comment or question before we put it to a vote?
Alrighty. All right, Secretary, we have a motion made by Representative Baumbach, seconded by Mr. Patel. Pete, please correct me if I'm incorrect. To fund the other program, which is the Innovation Fund at 1.2 million. Comments, concerns? All right, we'll jump into a vote. Rep. Bolden, absent. Senator Richardson,
Yes.
Mr. Fulton,
I'm voting no, but it's because I don't think it should be reduced.
thank you. Ms. Massa,
Yes.
I'm back.
Yes.
Chair Manning,
Yes.
Mr. Patel, Mr. Patel.
You're muted.
Oh, I see you saying.
I'm sorry, yes.
Thank you. Dr. Silver,
Yes.
Ms. Tuxford, absent. Dr. Lee
Yes.
and Senator Poor, absent. Chair, the roll call of that is 3 absent, 1 no, 7 yes. So with that, that motion carries. Thank you, Marie, for updating that. What's the pleasure? Would you like to move to the switch fund or the state operating? Those are our 2 remaining groups.
Can somebody describe the rationale for treating the last 2 groups differently from each other?
So this is Julie Devlin. So historically, the ones that were in switch funded were categorized as switch funded in years past. In doing research, Jules saw that they were switch funded into the Health Fund Advisory Committee tobacco funding around 2018. Was that correct, Jules?
Yeah.
And so we kept those in those. The other programs either were new applicants at one time to for tobacco funding, or they were put into the budget at a different time in the budget process.
Yeah, and I do want to note, and we touched on it a little bit last meeting, this is part of our internal work as an HVAC staffing entity to work through a lot of this of the history, because as you'll see, I know many of you looked at past reports, past budgets, those programs that were in switch funded, then they're in other categories and they're back in switch funded. And it's just been trying to line up the narrative of each report to each funding scenario has been time consuming. So with that being said, they're grouped this way mainly because of historical things. And then we heard from this committee that all of these state operating ones are ones that could go back to the, could go to our budget as a DHSS's budget in a different way. I did want to point out one program that we added later to this group, the DHSS state operating one, and that was the prescription assistance program through DMMA. In years past, we haven't recommended switch funding. However, I wasn't exactly sure why, but I'm pretty sure it goes back to the application. It's page 6 that has all of the, well, it might be different on different applications, but page 6 is what the health fund criterion code, and number 6 is promoting a payment assistance program for prescription drugs to Delaware's low income senior and disabled citizens who are ineligible for, do not have prescription drug benefits or coverage with federal, state, or private sources. So with that being said, again, there's a lot of internal work that Team DHSS we need to do on the historical funding of programs through HVAC. But I got my answer as to why this program seems to have been HVAC from the start. Not to say we aren't looking at it separately as well,
Right.
if that makes sense. So apologies, that was a lot of information at once.
Madam Secretary, is your sense that OMB and or JFC see these two categories differently or not?
No, these are our groupings. They don't look at the categories at all. They are looking at the individual programs. These categories were created to help facilitate our conversations here. They're internal to this committee, and they do not utilize these at all. So no, the reason they were grouped as switch funded is I think the idea is that those were actual things that we know at some point OMB and the General Assembly said, we're going to take these out of the operating budget and we're going to put them in health fund. It was deliberate. It was clear. So that's what those switch fund programs are. The other programs, the Genesis, this is less clear, but most of them were likely original applications and went through an application process and were awarded. They were not necessarily mandated through the process. So that's the only reason for that separation. So if the committee does not want to view them separately, I don't think they have to. It was really just to make clear that those three were in fact previously in the operating budgets.
Mm-hmm.
Well spoken.
But now we can just solve it.
Yeah.
Well, from a purely numbers perspective, my suggestion is that we recommend funding all of them at 65%. That will end up consuming 2.8 million of the reserve to bring it down to 9.56 million. More than the 8, which we said is certainly the minimum we'd like to see the reserve ended up. It would consume some of the reserves. It has it's sort of a 1/3 step to the elimination of these from the fund. So it gives the Joint Finance Committee and the governor a glide path to getting them back into the budget, or rather into the budget. And I think it does it at a measured way that doesn't desperately threaten the reserve fund.
As I've stated before, these are all my departments, so I am abstaining, but I do just want to comment that what you've suggested, Representative, is very consistent with what OMB is asking us to do, to partner to make these changes. They are not looking for a blunt instrument. They want to work with us on this. So your proposal is consistent with that.
For the purpose of official discussion, I will make a motion that we fund all the remaining programs at 65% of their fiscal 25 budget level.
I second it.
So, Paul, just to clarify,
Yes.
do we want to? Before I ask that question, a question to Madam Secretary or your staff. It's my understanding that the DPAC program funding is a requirement of the health fund. Legislatively, I thought that language in the legislation says that it shall be funded by health fund. Is that correct or incorrect?
So I believe the legislation says that the fund is to create it. I don't know that it says it's to be funded at a particular level. And I will note that they underspent by $350,000 in FY24. So, I can't tell you what their actual spend would be this year or not. I think that the obligation of the committee is to create it, but I don't think that it's specific to any funding amount, to the extent that the program exists and is underfunded. At the end of the day, if this fund is depleted, what happens to that program? I don't know the answer to that. I don't know how much, and I don't have any representatives from DMMA on the call today. I don't know how much this makes up of their total amount. If there's more, so I just, unfortunately, I don't have the answer to that today. But I would not,
But to the best of your knowledge, we are not mandated to fully fund the DPAP program.
no, could you want to pull?
Yeah,
Let's pull up the language one more time, just to be sure.
Let's see if I. Can you see my screen now?
Yes.
Number 6 highlighted here.
So it's promoting a
Yeah.
payment assistance program, and I think funding it in any amount could be considered promoting it.
Gotcha. That is very clarifying. So back to my original question to Senator Bombeck. I love this motion, and I'm supportive of it. And maybe we shouldn't include any language in this about our intent to reduce that 65% to some lower percentage in years moving forward. Is that something we should put there, or should that be in just the Secretary's promotion of it?
I think that should be a follow-up motion.
Okay. Gotcha.
We can definitely include in our narrative all of this as well, and follow it up that there was a formal motion made to do this, and then that will inform us next year when we go through this process again.
Gotcha. Thank you.
So, let me start there. Should it, Secretary, and someone can correct me if I'm wrong, should we do 2 separate motions on that? Then, Representative Bombeck, or we can do it all in one?
I think I've made it as one.
Yes, there's a motion pending,
Okay, so
and I believe there was a second.
yeah, there was. So we have a motion made by Representative Bombeck, seconded by Mr. Patel to fund the remaining programs, which includes the DHSS/state operating programs and the switch funded programs at 65% their fiscal year 25 budget level. Any comments, questions? All right, I'm going to take roll call on that. Representative Bolden, absent. Senator Richardson,
Yes.
Mr. Fulton,
Yes.
Ms. Massa,
Abstain.
Representative Bombeck,
Yes.
Chair Manning,
Abstain.
Mr. Patel,
Yes.
Dr. Silver,
Yes.
Ms. Tuxford, absent. Dr. Lee,
Yes.
and Senator Poor's absent. All right, with that being said, we had 2 absent, 2 abstain, and 6 yeses. That does meet the threshold we need, so this motion carries. And then I heard from committee there wanted to be another vote. So just looking for a motion on that to continue to propose less funding for those DHSS/state operating programs.
Right, so I guess, I'm sorry.
No, please go ahead.
No, I was just gonna put out for the group for discussion. The question is what would be our cut for these programs next year in our effort to get to 0? What percentage do we want to say we intend to cut next year?
So, I recommend that we cut it 1/2 from the amount that we're recommending now. So this gets us 1/3 of the way. That will get us 2/3 of the way, and then we eliminate it in the following year as the glide path to 0.
If that's a motion, I'll second it.
So, Madam Secretary, do you need formalization of the wording, or do you need the concept? Well, no, okay. How if I word it a little bit firmer? I make a motion that we recommend that the Secretary present with the specific recommendations the expectation of this committee next year, recommending a further reduction of the state operating program and switch funded line items by a further 50%, in order to achieve a 3-year smooth path to full elimination of this fund providing dollars for these DHSS operating elements.
I'll second that. Don Fulton.
All right, let's see if I can summarize this. So I have a motion by Rep. Bomback, seconded by Mr. Fulton, to request the chair for next year propose 50% less funding of the programs in the DHSS state operating grouping, withhold the expectation of decreased funding over the next 2 years to zero. We will
So
work out more appropriately. in this-
Jules, it's a
Yeah.
50% reduction from the recommendation we're proposing now,
Okay.
the reduction we're proposing now, 50% dollar reduction, and a total elimination in the immediately following fiscal year recommendation.
And Representative, clarifying question, I think Jules stated the DHSS operating programs. You intended to include the switch fund programs
I
as
did.
well? Yes.
Correct.
Thank you. Okay, thank you, Representative. I'm gonna take a vote on that. Sorry. I'm gonna take a vote on that, and we will ensure that this is written appropriately in our meeting minutes as well as in our narrative report. So, Representative Bolden, absent. Senator Richardson,
Yes.
Mr. Fulton,
Yes.
Ms. Massa,
Abstain.
Rep. Bomback,
Yes.
Chair Manning,
Abstain.
Mr. Patel,
Yes.
Dr. Silver,
Yes.
Ms. Tuxford, absent. Dr. Lee,
Yes.
thank you, and Senator Poor, absent. So the roll call for that is 3 absent, 2 abstain, and 6 yeses. So with that, that motion carries, and we will include that official vote in our meeting minutes as well as in our narrative report.
Jules, can you go to the front page now?
Yep, 3 minds popping over there. All right, so we've officially wrapped up voting of all sections, so this illustrates our totals, our shortage overall. So it looks like scenario 5 will be just about 26 million spent, 25.9. And then we'll have in the reserves 9.8.
Jules, can you relabel whatever that difference shortage overage and say carry forward reserve
Yep. Barry, do you mind updating that?
or reserve carry forward, something like that?
Carry forward reserve balance.
Yeah. Isn't it fun to be typing with everyone watching you?
Always. Yeah, shout out to Curry. Yes. All right, Secretary, that wraps up our official voting. We do have public comment, and I do want just committee members to have time if there's any last minute questions, concerns, suggestions for our out of session, our continued meetings that we will be having.
Okay. Yeah, one of the things that I do want to share is that this entire process, pulling all these applications together, reviewing the applications, vetting the applications, making sure they're complete, compiling them, getting them sent out, organizing these meetings, doing the agendas, doing the meetings, doing all of those communications, working with our budget team to develop, to get the scenarios developed. A huge thank you to them, by the way. And for doing all that, it's all Jules. She's one person. And to be clear about that, she's my legislative director. What that means is that during the legislative session, she's monitoring over 200 pieces of legislation that touch this department. And she's down at Lake Hall and she's testifying and she's, doing all kinds of things that candidly, in my opinion, make it humanly impossible to do this on top of it. And yet somehow she's been doing it. So I do think that we need to have conversations about the infrastructure that supports this committee and how that is done, because I think it's untenable to continue this way. And I want to give Jules a huge shout out for everything that she has done and for the attention that she has given this project. So thank you, Jules.
Thank you, Josette.
Thank you, Jules.
It's a pleasure working with this committee. We have such amazing experts on this team, and I'm very hopeful in the off season that we're gonna continue to make this process better. And I do want to just highlight, we've had more attendee participation in the last 2 years than we have after COVID. So it's this group is doing awesome work, and I'm very thankful for our chair that wants to put more attention and here's the committee to support, appropriate application distribution and review. So thank you, Secretary. All right. So any other comments, concerns before we move to public comment?
Yeah, I would like to mention something. My understanding is that the tobacco companies are buying up and very, very involved in the marijuana industry now. So I think that's something we need to keep an eye on, because if we don't, in the past, I'm not sure that we exactly trusted the tobacco companies to do the right things for the public. So I just want to make us aware of that and to address that issue before it gets out of hand.
Thank you, Senator. Any other comments?
Well, I tend to agree with the senator, and tobacco companies, I think, have no heart and no morals. I think they're looking to sell much product as they can. That's a personal feeling, and the same applies to vaping. And somehow we need to incorporate within our discussions ways in which to disencourage young people, particularly, from getting into vaping. The statistics are alarming in terms of numbers, and frankly, many of the youth that are getting into vaping are doing so having not smoked cigarettes first. So it's not kind of a backward trend from smoking cigarettes. It's vaping from the beginning, and so I'd like this committee to consider in the future ways in which we can encourage, particularly the younger population, from vaping and other electronic cigarettes.
Thank you all for bringing up those topics. Along those lines, I would like to identify menthol cigarettes in the African American community. But if we're going to possibly open the health fund for new application, there is a way that we can solicit for particular programs or initiatives that are targeted towards these areas if we feel that our current initiatives do not address that. So as we're thinking about applications for next year, if we're going to open it for new applications, possibly considering ways of proposing these as focus areas.
Agree with that 100%, Dr. Lee. I think we can be more targeted in the process.
Thank you, team, again. And we do not have any members of the public here today. If you are signed up virtually and watching this meeting and like to give public comment, please raise your hand. We'll limit public comment to 2 minutes. It looks like Greg from the Health Literacy Council just made a comment. Due to the historic evolution of this process, you have a very difficult task. Thank you for the inclusion. The opportunity to support the Health Literacy Council of Delaware won't let you down. Thank you very much.
Jules, I'd like to just add one comment. We're not seeing the revenues drop 80% a year or 20% a year. And I'd like the applicants to recognize that this should not be a death spiral, but part of this was necessary because of the magnitude of the state program still within the funding practice of the committee, and hopefully in partnership with OMB and Joint Finance Committee, as we glide to getting the state programs out, we should have a more sustainable and steady level of funding for these applicants. So this is a tough time, but there should be some brighter time starting next year, and certainly the year after that. So keep the faith.
Madam Secretary, I just wanted to share with the group that as we are finalizing this process, I am sure we would have opportunity to look at the draft before it goes to the governor, just in case.
We will make sure to send out the report to this team for final comments, questions, perspectives, make sure that we're all encompassing everything that was discussed over these 4 meetings. So thank you to everyone. And Representative Baumbach, thank you for your service. We will definitely miss you next year on the committee, and hopefully we'll see you as a member of the public here and there. So we know you can't get away from HVAC. And then Kate, thank you. Acknowledge your thanks to the committee in the chat. But that this concludes HVAC funding decisions for fiscal year 26. So thank you to everyone. Secretary, you can go ahead and close out the meeting.
Okay, just reiterating the gratitude for the folks who have been here and who have participated and have gone through these voluminous applications and made some really, really difficult decisions in the best interest of Delawareans today. I know it's not fun. I know it's not easy. And we literally couldn't do it without you. So I'm extremely grateful to have all of you here. This is likely my last meeting. So I wish you all the best in this work, and I will do my best to make sure that it is set up for you in the best way possible so that you can continue to advance this work next year. So with that said, I'll entertain a motion to close.
I make a motion to close.
Thank you. Is there a second?
Second.
All in favor?
Aye.
Aye. All right.
Aye.
Have a great day, everybody. Thank you.
Bye. Thanks.